Hi, my name is Cindy Robinson. I'm a student at Indiana State University in the nursing program. This is my PowerPoint slide on the holistic approach to healthcare, but I'd like to direct you to take my pretest before beginning. According to the Center for Disease Control, the average life expectancy for Americans is 78.8 years. The reasons for this are there's been many advancements in science and medicine, more people choosing a healthy lifestyle, and more Americans age 65 and older choose to live in communities such as assisted living, which improves socializing, activities, extra help for those seniors, and increases chances for a longer life. There are many health conditions that can be associated with aging. The longer we live, the more likely we are to develop things such as arthritis, cataracts, diabetes, hearing loss, dementia, just to name a few. With aging comes loss of bone density, muscles lose strength, our coordination and sense of balance can be off, and we can become overall frail. This can lead to multiple things such as accidents and falls. The 6 components of holistic health are physical, environmental, emotional, social, and spiritual. According to the American Association of Nurse Anesthesiology, physical health goes beyond absence of disease. It includes the conscious choice of a healthy lifestyle for prevention of disease within our control. The first step of a holistic plan of care is to determine what level of physical health he or she is in, and then build on it. The elderly are a unique population because there are common health conditions associated with aging. The vast majority will have different levels of health. One example could be someone confined to a wheelchair. It's obvious that he or she would not have the same level of physical health as one not confined to a wheelchair, but there are many things that can be done to enhance this person's health. First, we have to be honest when discussing physical ability and or disability with the elderly. There will at least be some degree of deterioration which will most likely continue to progress. The program must meet him or her where they are and work from there. To implement a physical activity program, it can be as simple as a walking program 3 days a week. Even those with a walker can participate, including in a wheelchair. A large portion of the elderly population have lung disease, such as emphysema, that requires around-the-clock supplemental oxygen. These patients require extra scrutiny to determine limitations. It is important to begin an exercise program slowly and gradually. According to the ANA, environmental health is determined by those such as air quality, food provided, cleanliness, quality of water. In the field of nursing, this means controlling things in the environment to the best of our ability that can cause or exacerbate health conditions. For example, nurses regularly encounter elderly with conditions such as COPD and asthma. The environment can definitely exacerbate these conditions. Provision 8 was added to the ANA Code of Ethics to address the specific issue of environmental health. It calls for nurses to not only be concerned with each patient, but also with the broader picture, including things such as world hunger and the environment. The ANA further elaborates that pollutants in the environment affect the poor and those of color at a higher rate than other ethnicities and class. This is due to the likelihood of the poor and those of color to live in substandard conditions and working with hazardous conditions such as chemicals. The elderly are more susceptible to illness related to heat also. Since the elderly are especially vulnerable to lung disease, they are also at an increased risk of pollutants in the environment. There is a section of the elderly population who are particularly vulnerable to emotional issues. Growing older brings about changes we all may face one day. This can include vision and hearing deterioration, mobility issues, and financial issues. These problems can be on top of living alone, which can equal poor quality of life, anxiety, and depression. These vulnerabilities faced by the elderly can cause insecurity, and seniors need to feel safe and secure. There are many simple and practical solutions to help with this. Changing locks on doors can help feelings of insecurity. Extra night lights can. Panic buttons can. Seniors need regular socializing with friends and the community. They need to feel as though they still have quality of life. Warning signs of depression can include, but are not limited to, loss of appetite, loss of interest in hygiene or one's appearance, changing of sleep habits, and recurring thoughts of death. According to Emory Healthcare, social health is the ability to positively interact with the community and world around us. It is very important for the elderly to maintain social interaction with friends and the community. Benefits of the continued involvement with friends and community include living longer, decreased risk of heart disease, and reduction in blood pressure. Groups with similar health conditions can find strength and renewed hope by socializing together. The National Center for Biotechnology Information defines spiritual health in relation to nursing as an umbrella term that encompasses not only religious affiliation, but also things such as the meaning of life and feeling connected. The NCBI found that spiritual well-being is directly linked to one being better able to handle both physical and emotional implications associated with various diseases. Spiritual health must be part of a patient assessment and problems addressed as they are discovered. There are many tools that have been developed to assess a nurse's knowledge, comfortability, and ability to address spiritual needs of a patient. Providing spiritual care can be as simple as being an avid listener, reassurance to an ailing patient, respect for beliefs, advocating for your patients, which we should always do, and providing appropriate faith-based necessities. A holistic approach to the elderly community can reduce depression, frailty, accidents, injuries, isolation, certain diseases, and falls. This can lead to more independence, a healthy social life, fulfillment, and a great increase in the quality of life. Thank you.